Good morning, everyone. Welcome to the U.S. Embassy Get the Facts on the Vax COVID-19 vaccine discussion. I'm Larry Socha, Public Affairs Officer here at the U.S. Embassy in Bridgetown, Barbados. Thank you for joining us, whether you're here in Barbados, elsewhere in the Caribbean, or anywhere around the world. The next 45 minutes will be time well spent to get your questions answered on the COVID-19. Joining us, whether you're here in Barbados, elsewhere in the So let's maximize our time, and I will turn it over directly to Her Excellency Linda Tagliatella, U.S. Ambassador to Barbados, the Eastern Caribbean, and the OECS. Ambassador, thank you for joining us this morning.
Thank you, Larry. Ministers of Health, Dr. Varun Dade, Director of the CDC Caribbean Regional Office, Jamaica. Nurse Aisha Jones, distinguished guests, ladies and gentlemen, a good morning. It is my pleasure to welcome you to the U.S. Embassy Bridgetown's public question and answer session on COVID-19 vaccines. This discussion is designed to provide you with the opportunity to ask questions about COVID-19 vaccines. People need to discuss healthcare decisions with credible sources in order to make informed choices. That is why we organized this session. Today, you will have the opportunity to engage Dr. Dade and ask questions about vaccines directly to an official source. Our moderator, Aisha Jones, is a nurse resident here in Barbados who helped vaccinate the United States Embassy community. They are representative of thousands of healthcare professionals on the front lines fighting this pandemic. To those of you who are healthcare professionals, thank you for what you do. COVID-19 continues to surge across the world, driven by a dangerous combination of highly contagious new variants and low vaccination rates. Unfortunately, the Caribbean knows all too well the devastation of COVID-19. Earlier this month, Grenada lost the precious young life of a teenager to the virus. Cases are up across the region compared to just a few months ago. The one thing we can all agree on is that too many people have died from COVID, both in the Caribbean and in the United States. And that is exactly why the United States is committed to sharing our resources to help end this pandemic. We have donated more than 110 million free vaccine doses directly to 60 countries. Just this week, the United States donated Pfizer vaccines to Dominica, part of our 5.5 million doses the United States pledged to the CARICOM countries. All the vaccines that the United States government donates are approved by the U.S. Food and Drug Administration and the World Health Organization. These are the same vaccines that all Americans can receive. The good news is the vaccines are available. The bad news is not enough people are taking the life-saving shot. There are doses that will soon expire right here in Barbados. So together, let's answer your questions and address your concerns. Let's protect ourselves, our families, and our communities. Ending the pandemic can help us get back to work and to enjoy football, cricket, and liming, just as we did before. I encourage you to take this opportunity to ask your questions so you can get the information you need. The facts about the vaccines are encouraging, and if we each do our part, we can end this pandemic together. We've done it before with polio and measles. Let's do it again. Thank you.
Thank you, Ambassador. So for all of you out there, tag a friend, tag a family member, tag someone you know who would be interested in this conversation. Maybe they're already vaccinated and they want to share this information with others in their community. But jump on WhatsApp, put their name in the comments section right now. We want to share this information with as many people as possible. So please don't be shy. Let's make this a great discussion this morning. As the ambassador mentioned, Dr. Dade represents the CDC here in the Caribbean and serves as the liaison between the ministries of health, different healthcare organizations, and the CDC headquarters. He's been with the CDC for more than 15 years and served in Haiti, South Africa, and Nigeria, and was deployed to support the CDC's response to the Ebola outbreak in West Africa in 2014-2015. He holds a PhD in molecular biology, virology, and a master's degree in genetics. So we're very happy to have Dr. Dade with us this morning. And joining us as our moderator today is Nurse Aisha Jones, who's been the embassy's nurse since 2018. She's been a licensed nurse for the past 11 years, spending many of those years at the Queen Elizabeth Hospital, which is familiar to many of us here in Barbados. She spent time in the accident and emergency department there. And she's been involved with the planning and the implementation of many vaccine clinics over the past 6 months. So she will be the one taking your questions from the comments section. Feel free to start now entering your questions into that comments box. She'll be taking those questions, sharing them with Dr. Dade, and continuing the conversation this morning. So that's it for me. I'll turn it over to the experts. Thank you, Nurse Jones, for leading the conversation.
Thank you, Larry, and good morning to everyone. I am pleased to be a part of this session as a healthcare professional, a Barbadian, a fellow resident of the Caribbean. This opportunity to have your questions about the COVID-19 vaccines answered is important to me. I would like to invite each of you listening today to submit your questions now and throughout the program in the comments on the post on the U.S. Embassy Bridgetown Facebook page. If you're tuning in from another organization's page, we will not be able to see your questions. However, you can keep listening or open the U.S. Embassy's Facebook page to submit your questions and comments. Please focus your questions on the safety of the COVID-19 vaccine. We will try to get as many of your questions as possible answered today. Any questions we do not have time to address will be addressed on a later forum. And with that said, I am pleased to open your questions and answer by presenting our first question to Dr. Dade. Welcome, Dr. Dade, and thank you for being here. A question we hear often in the healthcare community is, should I get vaccinated for COVID-19?
Sure. Good morning, Nurse Jones, and good morning to the ambassador and Larry, the PAO at the embassy, and the team, and good morning to the audience that is tuning in. Yes, so this is a very good question. Why should I get vaccinated? It is strongly recommended that everyone gets vaccinated. These vaccines have been proven to be safe and effective. They help protect us and our families. They can protect you from getting the COVID-19. Even if you still get infected after taking your vaccine, it will likely prevent you from getting seriously ill, getting into the hospital, hospitalized, or dying. The vast majority of the cases that we see today here in the Caribbean and globally in the hospitals are people who did not get vaccinated. So yes, we should get vaccinated.
Thank you. Our next question. I hear that there are side effects from the COVID-19 vaccine. Can you tell me about them?
Yes, thank you, Nurse, for that question. COVID-19 vaccine, like every other vaccine, is an introduction of an external object or piece or something into someone's body, and which is normal if our bodies react to that. So when we get the shot, some of the side effects that we get, especially at the area where we got the injection, is the usual thing we get with all of the other vaccines, all of the other shots, which is, and we should go in a couple of days. That is the common things, the arm, the soreness in the arm where we got the shot, some pain, some redness and swelling. And in the rest of the body, sometimes we can get fever, tiredness, headache, muscle pain, and nausea. So these are things that we do see normally in all of the vaccines, which simply means the vaccine is doing what it is supposed to be doing, which is to stimulate our body to react to that piece of material that we injected into the vaccine, or the content of the vaccine.
Thank you. All right. Our next question. Is it better to get natural immunity to COVID-19 rather than immunity from a vaccine?
Yeah, thank you. That is a very good question to address. And the straight answer is no. And the reason being, we don't know how natural immunity lasts. So when we get the virus, when we get infected, we develop what is called the natural immunity, the antibodies. However, we don't know how long that immunity lasts, and we don't know how good that immunity in each one of the individuals. So that becomes an individualized response to the virus. Therefore, because we don't know how long this immunity and how good it is better to get the vaccine, which provides that immunity that has been tested, the antibodies, the neutralizing antibodies that we know we get from getting the vaccine.
Okay, thank you very much. Excellent response, by the way. All right, what advice would you share with persons who are unvaccinated and would have recovered from the COVID-19 virus?
Yes, that's another good question to address. So for those who have gotten infected with COVID-19 and who have recovered, yes, they still need to get vaccinated. Reason being, number one, as we said, not only we don't know the time, the length of the immunity it takes, but we also don't know the quality of those neutralizing antibodies in everyone's immunity. That's number one. Number two, there are cases where it's not many, but there are cases of reinfection with the COVID-19. So it is important that one gets the vaccine, even if you have been infected. So, and again, it is also critical to know if you have been infected with one variant and we don't know the next variants that is going to be coming. We know of those that we are circulating, but there are some that we don't know, and no one knows which one they're going to be getting if it's something completely new that no one has seen. Therefore, getting the second dose or getting the 2 doses of the vaccine is critical, even if one had already been infected.
Thank you for that answer. Our next question. How likely is it for someone who is fully vaccinated to die from the COVID virus?
Thank you. That is a good question. So the data that we have now, not only the data that CDC has been collecting, but our colleagues and our collaborators in the other ministries of health around the world, what have been seen now is that over 90% of the cases that are hospitalized are those who are not vaccinated. For those who are fully vaccinated, what we know is that, number one, there is less likelihood of them getting infected to begin with. But we know they can get infected, those who are fully vaccinated. If they get infected, it is very unlikely, or the risk of them being severely ill or dying is extremely low. Now, there are situations, there would be some exceptions, but those are extremely rare. We have seen some countries report that 0% of the deaths has occurred in those who are fully vaccinated. And it is a very small percentage, if any, of those who are dying that have been fully vaccinated. It doesn't mean it won't occur, but the data currently that we have clearly shows that those who are fully vaccinated are protected not only from dying, but also from getting severely ill and getting hospitalized.
Thank you for your response, Dr. Dade. Okay, next question. My child is under 12 years old. Can they get vaccinated?
Yes, so this is a good question also. COVID-19 vaccination can help protect your child from getting COVID-19. Although fewer children have been sick with COVID-19 when we compare them to the adult population, they can still get infected with the virus that causes COVID-19. They can get sick, and unfortunately, some of them can die. So getting the children who are eligible to get the vaccine, 12 years and older, and we're hearing now that there is progress in testing the vaccines for those who are under 12. But right now, those who are approved for the vaccines are 12 years and older should get vaccinated. And the vaccination is obviously recommended for those who are 12 years and older. For the Pfizer vaccine, that's the one that is approved for the 12 years and older. So those who are able to get the vaccine, please get the vaccine. Not only it protects the kids, but also it protects the environment, the community they are in, and the schools if they are going to school.
Thank you. How long does the vaccine antibody last?
So the good news is that obviously we should start with saying that these vaccines are new. The quality of the vaccines, the safety of the vaccines has been proven. These are the same safe vaccines that have been administered globally. Over billions of vaccines have been administered, and they are safe. So we don't know how long the protection lasts. We know for the data that we have now is up to 6 months that has been proven that these vaccines are good. We also know that some vaccines have longer than the 6 months, and we are still observing and looking at the data since these vaccines have started. We also do know that what we really know is that COVID-19 has been causing and has caused severe disease and death. So the vaccine is the answer to preventing or avoiding the risk. So getting the vaccine is the safer choice, and to avoid being in that taking that risk.
Thank you so much, Dr. Dade. Is it safe to get a COVID-19 vaccine if I have an underlying medical condition, diabetes, hypertension, any underlying condition?
Yes, that's another good question. First, what we want to begin with is there are some personal or individualized medical decisions that should be taken by the healthcare provider of each individual. However, the general recommendation is that yes, those who have underlying conditions are amongst the populations who are at higher risk of getting a worse outcome if infected with COVID-19. So yes, they should be taking the COVID-19 vaccine if they have if they are severely immunocompromised or have conditions that cause them to have immune response deficiencies. They should discuss that with their healthcare provider. But yes, those who have underlying conditions are amongst the priority groups that should be vaccinated, actually, because of the potential bad outcome that they would be getting should they get infected with COVID-19.
Thank you so much for that response. Can I get vaccinated with the COVID-19 vaccine if I'm currently sick with COVID-19?
No. The guidance is that if someone is currently sick, infected with COVID-19, they should wait until they have been released from the isolation. And again, that is something that the Ministry of Health determines. Once they are released out of the isolation, the ministry and their care provider, then they are eligible to take the vaccine whenever. There is no contraindication on when or what. There is no maximum time for them to wait after getting released. They can take it whenever, as long as they are they have been released medically from the isolation. But while they are sick, no, they should not take the vaccine.
Okay. So is it safe?
The vaccines?
Yes.
Absolutely.
Yes.
Yes, absolutely. The vaccines are safe. They have been proven safe. They have been taken by billions of people now.
Yes. Thank you. Next question. Can COVID-19 vaccine make me sick with COVID-19?
The straight answer is no. None of the vaccines that have been approved by WHO or the FDA contain a live virus, which means none of them is able to cause you to get sick.
Thanks for that response. All right, next question. After getting the COVID-19 vaccine, Will I test positive for the COVID-19 virus on a viral test, PCR?
No, the answer is no. Again, none of the vaccines that have been approved by the FDA and the WHO give you the virus. Therefore, you would not test positive for the viral test. What the vaccines do is to tell our bodies to produce antibodies against the virus, because of a piece of the virus has been used to inform our body, or to stimulate our body to act as if the virus came in and to produce antibodies. So that's the antibodies, the immune response we get when we have a real infection. Then our antibodies prevent us from getting sick and prevent us from dying. But the virus is not in our body. Therefore, a test for the virus will not detect the virus.
Thank you very much, Dr. Dade. Next question. Will the COVID-19 vaccine alter my DNA in any way?
No. So yes, this is a very good question also, but the answer is no. COVID-19 mRNA vaccines do not change or alter your DNA in any way. The messenger RNA vaccines, called also mRNA vaccines, are the first COVID vaccines that have been authorized in the US and now being used also globally. The mRNA vaccines teach our cells to how to make a protein that triggers an immune response. And these mRNA vaccines, they cannot or will not or do not interact with our DNA in any way. Instead, COVID-19 mRNA vaccines work with the body's natural defenses safely to develop that immunity that I described earlier.
Thank you. Why do I need to get 2 COVID-19 vaccines as opposed to 1?
Right. Thank you. So depending on the different vaccines, for example, J&J is only 1 dose, and the remaining vaccines are 2 doses. So currently, that's what we have. The vast majority of them are a 2-dose vaccines. That is what they've been tested for. That is what has been proven, that the full protection is only received after the 2 full doses. If one gets only 1 vaccination, they get only a partial immunity, and that immunity wanes away after a certain time. Therefore, getting the second dose is the complement of the full immunity to get us the full response and for the best protection, and that lasts longest.
Thank you. Next question. Do I have to continue to wear a mask and socially distance after I've been vaccinated?
Yes, that is a very good question also. It is important to keep covering your mouth and nose with a mask, washing hands often, and staying at least away from 6 feet from others, even after you've been vaccinated. We don't know yet how much the transmission, how much the vaccines reduce the transmission. We know for sure that they do limit the transmission, and the proof is that the vast majority of those individuals who are infected and hospitalized and dying are those who are unvaccinated. However, we don't know yet how much of that. There's also not enough information currently available to say if or when will CDC stop recommending the people to wear a mask. Simply, we know that those who are fully vaccinated may still get infected, even though the amount of virus they get stays shorter compared to those who are not fully vaccinated. And we know that also that they can transmit the virus. The case of the study and the outbreak first time described in Massachusetts showed that fully vaccinated individuals were able to transmit. The good news is that the masking continues to reduce the amount of exposure. It prevents us from not only exposing others, but also getting exposed as we continue to follow those guidelines. And we don't know yet when those guidelines will change.
Thank you so much. These are very, very good questions, Dr. Dade. Next question. What happens when you contract a different strain of the COVID-19 virus? If the vaccine is so effective, why do I need to get a booster?
Sure. So this is a very good question. Right now, what we have is the vast majority of the vaccines that are available do work against all of the strains, the known strains that are circulating. So that is the fact. If the vast majority of the population gets the vaccine, then the aim is to get to what we call the herd immunity, so that the vast majority of people are immunized. Therefore, the virus doesn't get a vehicle to move around in the population, right? So the booster that we're talking about now, currently there is no. Everyone may have seen the most recent guidelines that came out, and the decision from the FDA to approve the booster only for those who are at high risk, or those who are immunocompromised, or 65 years and older, etc., but not those who are under 65 years and older who have received the full vaccine, which simply means the data shows that the vaccines are effective. They are effective against and protect us against getting the disease and getting severely ill and getting hospitalized. Therefore, the booster is only for those who have certain situations are defined as priority populations, those who continuously are exposed to infection, and we don't know to what variants they're being exposed at, and we don't know. Also, some of these individuals obviously are priority populations because of their immune status. Those are the individuals who are recommended for booster shots, but not for for those who are fully vaccinated and not within those groups.
Okay, thank you so much. Is it safe for me to have the COVID-19 vaccine if I have allergies?
Yes, that is a very good question. So the guidelines that we currently have for most people with allergies, the answer is yes. However, if you ever had a severe allergic reaction to any of the ingredients that are included in the COVID vaccines, you should not get the COVID vaccine. You can find the list of these ingredients on the CDC website and even on the company websites themselves. And if you also had an immediate allergic reaction to or any severity to other vaccines or injectable therapies, your doctor can help you make that decision whether you should take the vaccine or not. But for the vast majority of us who have allergies to peanuts and to seasonal environments, etc., the answer is yes. There is no problem.
Thank you for that. I heard the FDA and WHO approved some vaccines. Can you tell us what that vaccine or those vaccines are and what that means?
Yes, that is a very good question. So where we started, and the vast majority of the vaccines that we have now have been used or determined as emergency use authorization, have received emergency use authorization, or this is under the FDA and under the WHO, they term them emergency use listing, meaning they are listed under that approval for emergency use. Now, all of the vaccines, because of the safety and efficacy that they have shown, then they qualify for that emergency authorization use or emergency listing. Recently, yes, we did hear that the FDA did approve of the Pfizer vaccine. And that simply means they continue to apply the same rigorous rules and parameters that have been used for any vaccines, and more so actually for the COVID vaccines. And the approval simply means that they have also looked at not only the efficacy and safety of the vaccines and the data that has been coming in from the clinical trials, but the real world data they have seen that same safety and efficacy of the vaccine, but they also looked at the quality of the production of the vaccines. So that is another piece that now has been added, and that now qualified these vaccines to be approved and a sort of an upgrade from the emergency use authorization. The emergency use authorization is obviously showed that they have proved their safety and efficacy and everything. Their full approval simply confirms that. Not only confirms that, but it also adds the angle of the quality of the production, etc.
Thank you so much. Does the COVID-19 vaccines have any long-term effects?
So right now, where we are with the data, what we know is that the vaccines are new, just as is the virus. So far, from what we have seen, there are no long-term effect. What we know is that the virus itself does cause long-term effect. We know the long haul COVID situations where people, long after they have cleared the infection, that they are still having the symptoms, and that they can affect many of the organs. So that is the real problem, and that is getting the long haul or the long-term effects of the virus. If one can avoid it, they should avoid it. The safety and efficacy of the data so far have shown us that there is no harm or the risk of getting any long-term effect of the vaccines is way below the benefits of getting the virus, of getting the vaccines and avoiding the virus itself.
Thank you so much. Next question. How long does the protection from the COVID-19 vaccine last?
Okay, thank you. I think someone had raised that question earlier. So what we said is that the vaccines currently, we know that we know that at least 6 months that the vaccines are good for at least the 6 months, and we don't know how long ultimately this protection will last. But what we know is that the virus for sure causes serious illness and disease, and one should avoid it. But the 6 months, at least, we know we have data that shows that yes, these vaccines are good at least for that protection is at least for 6 months.
Thank you so much. Does the FDA approval trump WHO's? Which approval is most recognized internationally?
So the WHO is the World Health Organization and the international body that provides that guidance to the international community, including the United States. Obviously, the United States and many other countries, including Europe and here in the Caribbean, have their own regulatory authorities that regulate and provide further guidance to their countries. And the FDA is one of such organizations that provides that guidance to the United States. As far as the guidelines, the international community follows the WHO, including the United States. The United States is a member of the WHO. However, the FDA is the regulatory authority for the United States, and that provides that guidance and approval around these vaccines or these medical products. And the world, I think, whatever is available to the global community does also see and take the information from where they get and from where they trust.
Thank you so much for that. Are the current vaccines available effective against COVID-19 variants such as the Delta?
Yes, that's a very good question, and the answer is yes. The current data that we have shows that the vast majority of the vaccines are effective against the current predominant strain, which is the Delta variant. Yes, so they do, the vast majority of these vaccines do work that have been approved for the WHO and the FDA. They do work against the known variants, including the Delta.
Thank you, Dr. Dade. Are there any harmful ingredients in the COVID-19 vaccines?
No. So the ingredients are published. They are made public. They are available on the websites of CDC and the companies and WHO, and they do not include any harmful ingredients. And again, these are the same vaccines that have been used by millions of people around the globe, and there is no harm into these vaccines.
Thank you so much for that response, Dr. Dade. All right, so how do we report any problems or bad reactions that we may have from the COVID-19 vaccine?
Sure. Thank you, Nurse. That's a very good question. So one should visit or can visit the medical clinic or the doctor that is near them, their clinical provider, and they can also report, or those also can report to the Ministry of Health and Wellness in the respective countries. But yes, these are things that are reported to the clinics and the doctors who are near ones, and those where the individual have also the access to those facilities.
Thank you. Is it safe for me to get a COVID-19 vaccines if I would like to have a baby? Because these things are personal to some people. So I think this is an excellent question.
Sure. So currently, and most recently, the CDC has published data to show safety and the advice that women of childbearing age should take the vaccine once they decided that they want to have a child. So the vaccines, the benefits of getting the vaccine are way far more than the risk of getting pregnant and getting the COVID virus infection. So yes, it is safe and it is recommended for women of childbearing age who are planning or who are pregnant to take the vaccine.
Thank you. Thank you very much. So next question, for those persons or ladies, that are breastfeeding, is it safe for them to get the vaccine as well?
Yes, the same guidance applies to women who are breastfeeding. It is safe for them to take the vaccine. It is safe for their child to take the vaccine. In some cases, it's possible that antibodies have been detected in the breast milk, which is of no harm. But yes, it is safe for them. It is recommended for them to take the vaccine rather than not.
Thank you so much. Next question. Is there any information about the COVID-19 vaccines and its effects on fertility in both men and women?
Yes, thank you, Nurse, for bringing that question, or if it is from the audience. It's a very good question that needs to be addressed, and it's legitimate questions. People that, we hear the stories in social media and everywhere else. So COVID-19 vaccination is recommended for everyone 12 years and older, especially for the Pfizer and other vaccines, 16 and some are at 18 and older. And for those who are trying to get pregnant now or might become pregnant in the future, as well as their partners, there is no evidence that shows any problem that any of the vaccines, including COVID-19 vaccine or any other vaccine, cause fertility problems, problems trying to get pregnant in women or men. Yes. So no, there is no data, there is no science that shows any proof or any reason to have any concern that this vaccine cause any infertility problem.
Thank you so much, Dr. Dade. This has been a very informative session. Unfortunately, we are drawing near to the close of the program and have time for one more question. I want to thank you for your response, especially all of our viewers today as well for their questions. And we're going to go to our last question, unfortunately. Our last question is going to be, do I need a COVID-19 vaccine for travel?
Thank you. Thank you for that question also. So all U.S. immigrant visa applicants are required to complete a medical examination as part of their normal application process. Now, effective October 1st, 2021, a complete COVID-19 vaccine series is a new CDC requirement for those who are planning to migrate or those who are applying for the immigrant visa application. The Department of State is currently working with the CDC to implement this requirement, and it does not apply to the other categories of the visas, like the tourist visa and the student visa. So we want to make that very clear that this applies to those who are applying for the immigrant visa. Now, most recently, the White House announced on September 20th that beginning in November, all adults, foreign nationals, those who are not U.S. citizens and who are not permanent residents, are required to be fully vaccinated in order to enter the United States. So that is starting November 1st.
Thank you so much for that clarification, Dr. Dade. All right, so thanks again so much. Thanks to everyone for your questions. I now invite the U.S. Public Affairs Officer, Mr. Larry Socha, to provide some concluding remarks.
Thanks, Nurse Jones. Thanks to you and thanks to Dr. Dade for the last 40 minutes here in answering a lot of the good questions. I really appreciate the honest, transparent, informative conversation that we've had. And I know that many people who are joining right now are going to jump on Google and they're going to type in their question. Maybe it didn't get answered or maybe it's a follow-up question. But I just ask that when you go online, please consult cdc.gov. Read the page of who.int. Go to these reputable sources and get the answers. Many of these websites have a FAQ, a frequently asked question page. Go there and get the information so that you can make an informed decision. You know, last night I saw the reporting here in Barbados of Dr. Corey Ford, who is Barbados's head of infection prevention and control. And he said yesterday at one of the facilities here that's part of the healthcare apparatus to stop the pandemic, he said, step forward and go and get vaccinated. Take care of yourself and take care of your neighbor. And there's no more important message than that. Each of us has the choice by getting vaccinated to end this pandemic. Please make the right choice. Get vaccinated. Get your questions answered, and let's defeat this pandemic together. Thanks, everyone, for joining today. The comments section is still open, of course. Please go to cdc.gov, who.int, and other sources of information to get your questions answered. We'll continue to do our part here at the embassy, as will the CDC here in Barbados, Jamaica, and throughout the world. Thanks, everyone. Have a great morning. Bye-bye.